because I do not like taking medicine. I'm not on any medicine and I really don't want to. And I was able to do it with this program, and that was the best. That was absolutely the best.
Hey guys, it's Dr. Ryan, and today what we're going to do is talk with a patient of mine, Carol. Carol's been a patient of the clinic for just about 4, maybe 5 months, and she's going to tell us a little bit about her experience with the clinic. So, Carol, why don't you go ahead and tell us a little bit about yourself, where you're from, what you do, some of your hobbies, your family.
So, my name is Carol, and I'm originally from Connecticut. I now live in Florida. I'm a mom of three boys and a grandmother of four grandchildren. My husband and I had our own business for the past 14 years, and we've been very successful, which enabled us to do a few different businesses. And we now have those as our hobby. We sold our biggest one, and we still have one that we work at part time, but it allows us to work out together, be active together. So, a hobby that we like to do is play pickleball.
Hmm.
We love to golf. We live on a golf course now.
Hmm.
We go to the beach a lot and we walk a lot.
Very cool. Very cool. What was it like prior to you starting with the clinic? What were some of the goals that you were trying to accomplish?
Well, once we sold the business, and I say that because we were limited on time. So we did a lot of walking, but we didn't have a lot of time to commit to the weightlifting as much as we did. So we would probably work out like twice a week and we walked, but we both had the desire to eat correctly
Hmm.
and exercise. We knew how important it was, even with all the stress of all the work that we did do. So we had reached out to different trainers, different workout programs, different weight loss programs. It actually all started when my son got married
Hmm.
in 2015, and we looked at our pictures and we weren't really happy with our results. And
Hmm.
we said, we're getting older and our health is really important. So when we sold the business, we're like, let's find something that works for us. So unsuccessfully, we kept trying different programs because nothing really got us to where we wanted to be. When How I found out about Sum Up was my husband was doing research. He's always doing research. So he found out about the Sum Up program and he told me all about it. And we got really excited and we are like, okay, good, something new, something similar to what we've done before,
Hmm.
but something we could commit to. And I love the accountability because that keeps you honest, weighing in, measuring, taking pictures. It's very easy to follow the plan.
Yeah.
And so we decided to try the program.
Very good. Very good. So let's go take a step back and actually go back to that situation where you're still deciding. There's lots of different programs out there. There's lots of different clinics out there. And, you had mentioned there, you were excited, but there was a little bit of hesitation when you first started between deciding between different options. So what were some of your fears upon selecting a program before you got started? What are some of the things you were afraid of?
Well, as you're getting older, you feel like, how much more time do I have to find
Mm,
the right program that's going to work for me?
mm,
Do I have all the time I need to commit to the program? Because it is definitely a big commitment, and you
mm,
want to make sure that you have that time to do it. If you're not going to commit to it, if you're not going to commit, then there's no sense like beginning it
mm.
because it's definitely a commitment, but I think it's well worth the commitment. And I guess that's what I found out after. That was the fear, but then we had to take a chance and we said, no, we have to make this commitment.
Mm.
What other fears did we have? Probably, I mean, something that we've never done before, which was, injecting certain things,
Mm.
was, can we do this?
Mm.
And we found out we could. It's not always the most pleasant thing, but we
Mm.
got through it. We get through it.
Mm.
And a lot, we thought it'd be a lot tougher than it was. And it really has worked out into our lifestyle very, very well. Very well. We're very happy.
So it sounds like a lot of the fears were more based around your time commitment, which, is understandable. You guys are very busy, as well as injection anxiety, which, as you mentioned, I mean, nobody likes injections, but there are ways to mitigate it using smaller needles, using less injection frequency, things like that, which it sounds like you guys surmounted, which is good. So
Absolutely.
you had these concerns, and albeit perhaps some other ones, but what finally made you say yes to myself in the clinic? Because again, you there are many options out there, and you always have a choice. But what made you say, okay, I'm going to go with this guy. I'm going to go with Dr. Ryan. I'm going to go with Sumo.
Well, the testimonials really helped. Both of us looked at quite a few of the testimonials. We really took the time because of the investment to watch them,
Hmm.
read them, and follow them. And then I talked to Martin at
Yeah.
Sum Up, and I really liked Martin, and he helped. He helped me over that little bit of hump, and with him, I got even more pumped up and excited to, yes, I want to do this. Yes, I'm going to do it. And let's just do it before I change my mind.
So after joining the program, what changes did you notice in your physique and overall health? And before you answer, I do want to take this opportunity to kind of brag on you a little bit. So obviously with my patients, I expect that there's going to be some changes in regards to their lab values and regards to their physique. But what was remarkable about you guys was how quickly it occurred. So first things first, what was pretty amazing was just the dramatic change in terms of some of these biomarkers. So everyone's concerned about their lipid panel. Your total cholesterol dropped close to 90 points from 269 to 186 without any use of conventional medications like statins. This was just you and your diet and the training program, which is really, really amazing. Your LDL, most of the drop was secondary to your LDL, which went from 170, which is quite unhealthy, to a much healthier 100, right? Which is really, really
Yes.
remarkable. And then the other thing I was pretty impressed with was your apolipoprotein B. In the longevity space, and a lot of more forward-thinking internal medicine and cardiologists are utilizing this as a marker of atherosclerosis, scarring in the arteries. And your levels went from a very unhealthy 125 to a much healthier 99. Oh, we still have work to go or work to be done, but we will get there and we'll get under 90. And I'm certain that will happen in the next couple of months. The other thing I thought was pretty amazing was a marker of methylation. A lot of PCPs will overlook this particular biomarker, uh, though no fault of their own. It's just not something that's typically tested. Uh, but it has some pretty far-reaching effects in terms of determining someone's predilection for developing cancer or heart disease or stroke. And your levels were a little on the high side when we started, but you were able to crush them down to a much healthier 7 micromoles per liter, right, from 11 to 7, which is pretty amazing. And then let's be honest, you were never diabetic, but you were kind of moving towards being diabetic. You're at 5.6, which just is zero point 0.1 away from being pre-diabetic, and you're able to move to a much healthier 5.4. So very, very impressive. Another thing I thought was really cool is your life protein A. So this is more of a genetically mediated marker. For a lot of people, in conventional medicine, are like, well, hey, you're stuck with this number, but you're actually able to change it just with diet, which is kind of unusual, but you're able to drop it from 72 to 50, both of which weren't bad, but you got into a much healthier 50. And then finally, the last thing I wanted to mention is another marker that we look at for atherosclerosis, your VLDL dropped really, really low. So from 29, which is not bad, to 19, which is excellent. And if you follow an appropriate diet, optimize your hormonal levels, take certain supplements, work out a certain way, you can definitely accomplish it. Speaking of working out, so not only were you able to repair your body from the inside out, you were able to make some pretty dramatic changes in terms of your physique. I was really impressed with the weight loss that you were able to experience when you came to me. Let's face it, you were quite athletic, right? And you were in good shape, right? But you were able to get much leaner within a very short period of time, about three months or so. And that was evidenced, or the evidence was quite clear from your pictures. And this is what you looked like when you started. You look much leaner about 3 months in, right? I think you can. It's a little more evident on the side profile because, and a lot of women have this. They tend to carry a lot of adipose tissue near their lower abs, but in your case, you're able to cut it down quite a bit, which is pretty amazing. And then many women tend to have adipose tissue deposits in their flank area as well as in their inner thighs. But in your case, you were able to really, really reduce it. So that was very, very good. Well, I mean, Carol, outside of those changes that we talked about, did you notice anything else?
I mean, I just feel so great. I feel, it's nice to dress up again and
Mm,
to fit into those clothes that you look at in your closet and say, no, they're too tight. I'm
mm,
still going to keep them in the hope that I'll fit back into them someday. And now I don't have anything that's too tight. And I guess that's just like so wonderful. It really is. You have no idea. Like menopause is such a killer. And when you get it and then you're just back to where you used to be, you're just so excited and you just want to keep going with the program. And you're like, I feel great. I'm looking great. Every week it's better. And I know I'm healthy because we're doing the blood work and I'm not really getting sick like everyone else. I was able to do it without medication. When I found out how high my cholesterol was,
mm.
I had told people, and everyone's like, oh, go on this, go on that. I said, no. I said, I'm starting a program of diet and exercise under a doctor's supervision with supplements, and I'm going to follow his program because I do not like taking medicine. I'm not on any medicine, and I really don't want to. And I was able to do it with this program, and that was the best. That was absolutely the best. And everything that we both feel from being on the program,
Mm.
we're not happy enough. We really are. This is wonderful. It really
Excellent.
is.
What about some of those concerns and the fears that you had prior to starting the program? A lot of them centered around time management as well as just medication administration. Did they turn out to be legitimate, or were you able to kind of dismiss them?
No, absolutely. So the injections are definitely not a problem. It's twice a week. It really is not bad at all, especially the more you get used to it and you
Yeah.
understand and you realize. And then any of the other fears, I guess the other fear that we had too was, would it last? Would we be able to make this be our way of life?
Mm,
Because it's not a diet. It's not something that you do right now. This
mm,
is our new way of life for the rest of our life.
mm.
In the future, when we get to exactly where we want to be, we'll be able to introduce a little bit more than what we have now, but we're very comfortable where we are. And we know that by following it, we're doing great. And it's staying. And I guess that was also a very big fear of ours. Will it last? Will it really work? And yeah, they do. And it's great.
Yeah, I think that I'm glad you touched upon that because it's really important for a program to be sustainable for the long term. I mean, it's great to get your physique to a certain way, but if you can't keep those changes year after year, there's nothing more frustrating than getting to like a particular area and then just watching yourself backtrack. So finding a program, a diet program, medication regimen, supplement program where you can do it is really key. And you mentioned that. Okay. So what about you did kind of talk about like the changes that you noticed, right? But
Yes.
what about changes outside of yourself? Like, did you notice any changes in terms of your business career? Did your family, friends, and colleagues, did they notice any changes as well?
Yes, so we have had a lot of comments and a lot of our friends up north who hibernate a little bit more than we do notice the difference. But it's increased our ability to sleep really well. It's increased our ability to have that energy to do a lot of activities. We're, in our late 50s, early 60s. And a lot of people our age aren't as active as we are, and I think that's a result of being able to eat well and exercise and our time management has been great and we're able to fit in the workout. It wasn't as demanding as we thought it was going to be. It's been enjoyable, and that was really important too. Like, I don't really want to spend 2 hours in the gym every day to be able to get to where I want to be. At most, it's probably 45 minutes to an hour. without the cardio. And I'm fine with that. That's like perfect. And cardio could be as simple as a nice brisk walk. And you're talking about half an hour, and anything more than that is extra. It's perfect. So really the time commitment that you have to give to it is fine. We do a lot of meal prepping, and it saved us money on our groceries. It simplified our life and our grocery list. And we do a lot of meal prepping, which is great because we plan it and then it's all set. We don't have to really think about it. Or you come home and you're like, I'm starving, and you grab the wrong thing out of the refrigerator. So in a lot of ways, it's really helped our lives a lot for other activities, really. So we enjoy it.
Yeah.
And we do it together, which really, really helps.
Yeah, it's really nice having a partner who's just as committed to their health as your health. And it sounds like you and Sal have a great partnership, outside of working out, of course, and it's just strengthened that to a certain extent from what you told
I
me.
agree.
Okay, so to kind of sum things up, what would you tell other women that are similar to you, professional women who are thinking about trying the program? What would you tell them?
Well, I think that it really is important for your health in many ways, because when I worked so much and I was stressed, it helps to relieve that stress. It gets you into a place where you're working on you, because when you are so busy and you are working so very hard all the time, you wish you were out there doing it, and then you have regret and you have guilt. And you don't have it when you just make it part of your life. You don't think about it, you make it a habit. And it's a healthy habit, and it's something that will help you in your job. It's something that will help your body. I remember all the pain from standing and sitting all day and night. I remember not sleeping well because I couldn't shut my brain off. And these are ways to get away from the work and just do something for yourself. I mean, at most, you're talking about a minimum of just an hour, 4 times a week. One day a week, half an hour. If you could do 4 workouts and 5 days of cardio, you're going to feel so much better, and you're going to look better. And that's going to make you even feel more better. I know that's probably not a right word, but I remember doing that, and work consumed me. And I wish that I had done this sooner. I really do, because and actually with work and the meal prep and all that, it actually makes your life a lot easier. You won't be skipping meals anymore like I used to, or skipping breakfast and lunch, and that's not good for your body. So really, all the things that the program does is just an enhancement, and it'll make you a better professional.
I'm really happy that you shared that, because I think that there are a lot of women in similar situations to you who are just doing so well in their professional life, in their business, in their career, but in other aspects, particularly their health, it feels like they're wading in the ocean. They're looking for a solution, but they're just having a very hard time. And I'm really happy that you're able to fix this issue, because a lot of us know what to do. It's just we don't have a program or a protocol to help us get there from point A to point B. And I'm really happy that you're able to see
that's
success.
actually
Okay.
that's a really good point. We know what to do.
Yeah.
But when you are not accountable to someone, when you don't have to report in, you don't have to measure weigh in, you won't do it. It's simple. It's just an hour for 4 days a week. But and I have my pill box, and I have my supplements for the morning and night. Everything is just organized. It's there. It's simple. It helps you to succeed. It just makes your life easier. And when you hit menopause, believe me, I never had a stomach till I hit menopause. And you're going to get fat in places you really don't want them to. Everyone, that's the biggest thing that I get now. how are you getting rid of that stomach? Because that's what we all get in menopause. Well, guess what? You use this program. That's how you get rid of
Yeah, and
it.
I totally remember talking to you about that when you started. Like you genetically you were very, very lean up until you hit that period. You had told me that, you didn't really have to try that hard in terms of your diet and your training program, and you're able to stay, in shape and your clothes fit appropriately. And then once you hit that point, perimenopause, menopause, things just kind of went downhill, right? And so I'm
Yeah,
really
I
happy to
haven't
hear.
met too many women who successfully stayed the same through menopause. At least the
Yeah.
beginnings or the middle, maybe on the back end, but oh my gosh, it does help though, because everything, even the hot flashes, I'm sure, and then the hormone therapy. I mean, that's another big thing because
Mm,
I also have underlying bone density issues. And so
mm.
now I'm on a program that's going to help me with that. I don't want to take osteoporosis shots, but that's my path if I don't do something about it. And Dr. Ryan's working with me on that so that I can
Yeah.
also help solve that problem. And that's also very big.
Yeah.
So I yeah,
That's a huge point. And a lot of individuals aren't aware of this, but hormonal optimization can make a big difference in terms of bone density. We know working out's important, we know your diet's important, but that drop off in estrogen and testosterone and progesterone is all linked to a drop in bone density. What's kind of interesting, it's true for men and women. Men develop osteoporosis as well, but it's much more profound with women because you guys have pretty decent estrogen levels prior to menopause, and then it just kind of goes to crap afterwards, right? And so
it
optimizing those
does.
levels can make a big, big difference.
Yep.
Well, Carol, I really appreciate you taking the time to talk about the program, and I'm so happy that you've seen the changes that you've made over the past couple of months.
Me too.
And I'm very, very thankful to have you as a patient.
Thank you. I really do appreciate everything that you and your team have done. I really do.